Now, Eyewitness News, first at 4.
And while vaccinations are now underway, so many people still have questions about it. And all week at 4:30, we're going to answer some of your questions about the vaccine. Dr. Alan Bulbin, the Director of Infectious Diseases at St. Francis Hospital, Roslyn, joins us now live via Zoom. Thanks so much for joining us. First question, Dr. Bulbin, what if a person is exhibiting COVID symptoms? Will they be able to get the vaccine, or will the symptoms and the symptoms that they may feel from the vaccine kind of collide in not a good way?
Right. Well, anybody with symptoms really needs to be evaluated for treatment, immediate treatment, sooner the better. That's what we have been pushing for, awareness. If you're diagnosed, if you're symptomatic, please get checked out because you may really benefit from treatment, and there's a lot more available. The vaccine is really a separate issue. We don't really want to give anybody who's sick with anything, any symptoms, at the time you receive a vaccine.
So let me ask you this. If people are going to get the vaccine, should they be getting a COVID test before the vaccine just in case they are asymptomatic?
Routinely, we're screening anybody who's walking in and who's scheduled for the vaccine as far as symptoms and temperature checks and the usual screening procedure that we do every day when you walk into the hospital or to work or wherever it may be. But it's not absolutely essential that you have a test prior. It's really, are you symptomatic at that moment? Because we don't want to confuse any possible symptoms from the vaccine with what could then be linked to the emergence of illness, of the disease itself. So it's really all about how are you feeling at that moment. You will be questioned about all those symptoms. You'll get checked. And if you are asymptomatic and you are ready to go, which I hope everyone should be, you'll get your vaccine. In fact, I got vaccinated today.
Did you?
Yeah, it was amazing. I'm so excited. Everything went well. We just rolled it out here today, and it's just really an amazing effort. And I'm just can't be more excited that we started down the vaccine journey.
I feel I should congratulate you for being one of the first. In terms of how you're feeling since you have been vaccinated, how is your arm? How's the injection site? How are you feeling?
So far, no issues. It felt like the flu shot, honestly. Little pain at the time, but right now, so far, roughly 4 hours later, I'm feeling fine. Thank you.
Well, again, congratulations. Thank you so much for your insight into the vaccine and the vaccinations. And again, like you said, a lot of people need to get out there, get their arm out there, get vaccinated so we can get through this pandemic together.
Fully agreed. Everyone, please. It's just an amazing feat that we have this vaccine available. The science has been a wonderful support for us as frontline workers. And finally, we could sort of see some light at the end of the tunnel that we're all heading down that new vaccine journey. And I implore everyone to seek a vaccine if the opportunity arises.
All thanks to medical technology and to frontline workers like yourself. Thank you so much for joining us this afternoon. We really appreciate it. Thanks, Dr. Bulbin.
My pleasure.